Okay, imagine an AI that has instant access to every single medical textbook ever written. I mean, that sounds like the perfect doctor, right? But what if that AI couldn't actually tell the difference between good advice and bad? In a field like medicine, where the stakes are incredibly high, this isn't just some thought experiment. It's a massive safety challenge we have to solve.
So, that brings us to the big question. Can an AI really be a good doctor? And we're not just talking about spitting out facts here. We're talking about something way more important: judgment. Can we actually trust it with our health?
And that really gets to the heart of the problem. You've got this split between having access to pretty much infinite knowledge on one side and the ability to actually reason with it on the other. Look, an AI can ace a memory test, no problem. But medicine, and especially something as nuanced as mental health, demands sound judgment. It's this gap between just knowing stuff and truly reasoning that researchers are racing to figure out.
All right, so here's how we're going to break this down. First, we'll look at the incredible promise of AI in medicine. Then, we'll explore this special kind of open book test that's designed for these AIs. After that, we'll see how researchers created a totally cheat-proof exam, check out the AI's final report card, and wrap up by talking about why reasoning is so much more important than just remembering things.
So, let's kick things off with AI's medical promise. Now, in any clinical setting, doctors follow super strict protocols. It's all about patient safety. The problem is, you can hand an AI the exact right medical guideline, but there's absolutely no guarantee it's going to apply it correctly. And in medicine, that little gap between knowing something and doing it right can be seriously dangerous.
So to try and fix this, developers had this really clever trick. You can think of it as giving the AI an open book test. The technical name for it is Retrieval Augmented Generation, but everyone just calls it RAG. So what exactly is RAG? Well, it's a technique that lets a large language model go and look up information from a trusted source, say a set of official clinical guidelines, before it gives you an answer. The whole point is to ground the AI's response in actual facts and, stop it from just making stuff up. It's supposed to keep it honest.
Okay, but here's the million-dollar question, right? Just because the AI has the book open to the right page, does that mean it's actually reading it and understanding what it says? Well, some studies show that, a lot of the time, AIs just ignore the evidence they're given, and that's why researchers realized they needed a much better test, one the AI couldn't just cheat its way through.
And this is where the really cool part comes in, the cheat-proof exam. A team of researchers created this brand new benchmark they call CARE-RAG. And to really put these AIs to the test on clinical reasoning, they used a real-world, highly structured therapy for PTSD as the testing ground.
That therapy is called written exposure therapy, or WET. It's a proven text-based treatment where following the steps to the letter is absolutely crucial for the patient's safety and for the therapy to even work. This makes it the perfect high-stakes environment to see if an AI can actually follow complex instructions when it really matters.
Now, here's how they made the test so clever. They didn't just ask the AI a bunch of questions. They tested it under 3 totally different conditions. First, they gave it the right information, the correct clinical guidelines. Simple enough. Then, they made it tricky. They mixed the correct info with misleading but believable distractors. And for the final test, they gave it only wrong but still plausible-sounding information. This was all designed to see if the AI could actually tell good information from bad.
So, how did they do? Did the AIs pass this incredibly tough exam? Let's take a look at their report card. The researchers put 20 of the top AI models in the world through this whole CARE-RAG gauntlet. And they graded the models on 2 really important things. First up was the accuracy score. Pretty simple. Did it get the right answer? Yes or no? But the second score, the inference score, was the real test. Did it actually use the evidence it was given to get to that answer? You see, it's not just about being right. It's about being right for the right reasons. That's the crucial part.
And the results are just fascinating. Take a look at this. A lot of the big-name models like GPT-4o and Llama 3.1 got perfect or almost perfect scores on accuracy. They knew the right answer. But then look at their inference scores. They're way lower. What this tells us is that they were often getting the right answer without actually using the correct clinical guidelines they were provided. They were basically guessing, or just pulling the answer from memory, not reasoning from the evidence.
And this chart just lays it all out, plain and simple. Across the board, you see really high accuracy. The models are great at finding the right answer. But there's this consistent, major drop-off when you look at inference, their ability to actually ground that answer in the evidence provided. This is what the researchers called the reasoning gap, and it's the fundamental problem they uncovered.
A human clinical expert who reviewed the AI's answers just hit the nail on the head. The models often miss the subtle, little details that are so critical in therapy. For example, a bunch of the AIs suggested giving a patient feedback on their writing in the very first session. Now, that's a small mistake, but it's an important one that any human therapist following the protocol would know not to make.
So this all boils down to one final crucial idea: reasoning versus remembering. If we ever want an AI to be truly trustworthy in a hospital or a clinic, it has to be a fantastic reasoner, not just a good memorizer. It's got to show its work.
And here is a stat that just absolutely floored me. Out of all 20 models they tested under all those different conditions, how many do you think got a perfect reasoning score? The answer is 0. Not a single model, not one could flawlessly reason with the clinical guidelines in every single scenario.
So, where do we go from here? Well, the researchers are pretty clear. It's not about giving up. It's about getting smarter. This means things like designing much better prompts and what they call reasoning scaffolds to help guide the AI's thinking process. It also means building in guardrails to prevent dangerous errors. And, this is the big one, continuing to test and challenge these models with really tough, real-world benchmarks just like this one.
And that kind of leaves us with one final thought to chew on. An AI might give you an answer that happens to be correct, but if it can't explain why it's correct, if it didn't use the right evidence to get there, can we ever truly trust it? When it comes to something as important as our health, is just getting the correct answer ever really enough?